So obviously it's been incredibly busy in general practice through the pandemic. We've been here in the practice open throughout, seeing our patients, as we can in a safe manner. And at the moment, with the boosters being announced, we're really going to have to ramp up our access to give boosters to patients. That's a big priority at the moment. Having said that, we also want to provide ongoing care to our patients. So we want to ensure that everyone who needs to be seen that's got a medical concern contacts the practice in the right way. We're trying hard, as all GPs are, to keep our patients safe during their visit to the practice. So the things you will notice, one is that you won't get an appointment without being spoken to by one of the doctors. We want to make sure that you're safe to come in. If somebody's got symptoms of COVID, we will ask you to self-isolate to get a PCR test, and obviously wear a mask during your visit to the practice for, out of courtesy to everybody else in the building. I think key messages are, if you've got a severe emergency, which is things like a suspected heart attack or stroke or severe breathing or pain, you should call 999. Don't wait on a queue in the phone. If you've got something that's more urgent for the day, I'd suggest that you either call the 111 service or try and get through to your GP practice on the phone. It will be busy, but hold on, we will get back to you as soon as we can. Anything that's less urgent that you think might not need the GP and doesn't need a 999 call, think about other ways of doing that. So one method is certainly using a secure web form, which you'll find on most GP websites. They're normally responded to within 1 or 2 working days, so it's a really good way of getting non-urgent advice. Don't forget about your community pharmacy. They're really helpful. They've got private consulting rooms. They can advise on many over-the-counter medicines. They will refer you back to the GP as needed. Think about the NHS 111 website and the app. They've got really useful information on there. But I do want to give a message that if you have some what we call red flag symptoms of suspected cancer, please arrange to see a GP urgently. You'll be referred off within 2 weeks if you have suspected cancer. It's really important to make that point, and equally for suspected heart disease. But we are open, we do want to see you, but we are incredibly busy with the booster program now as well. So if you can do anything to keep the phones free or to get the help elsewhere, then that would be appreciated.